Group Chief Executive Officer of AMREF Health Africa and the Chair of the Organizing Committee for the main conference, for this conference and the main one, of what we are calling the Africa Health Agenda International Conference. And on behalf of our partners, it is my great pleasure and humble honor to welcome you all to this Youth Pre-Conference. This Youth Pre-Conference Forum is a special part of the main conference, which begins next Tuesday in this same hall. The main conference is also a very important gathering of people from across the world, coming together with a common objective of discussing and defining the Africa Health Agenda in the context of the Global Health Agenda. But before that conference starts, we felt strongly that it was necessary to bring together representatives of the youth of this continent, and I'm glad that we have youth here from many countries, and Her Excellency Gertrude Mutharika will be happy to know that I'm told we have 3 youth from Malawi here as well. But before that conference starts, we felt strongly that it was necessary to bring representatives of the youth of this continent to discuss matters pertaining to their health and how they could feed into the decision-making both at this conference and in their respective countries. Your Excellencies, ladies and gentlemen, the theme of this entire conference, starting today up to next week, Thursday, is towards a healthier Africa, people, systems, innovation. The first part of that theme is people. And we ask ourselves the question, who are the people? If I was to be asked to deliver an individual who represents each continent's population, using the median age of the population of that continent, the following would kind of represent each of the continents. Europe would be a 42-year-old person, probably female. North America would be a 38-year-old, again probably female. Asia would be about 30 years old, probably male. And Africa would be a 19-year-old person. We must not continue to moralize on sex education and access to sexual reproductive rights. We must trust the youth with our institutions and with policy and with governance. We must let the future evolve if we are to realize the dividends. I'm glad that we let go, and it is a great testimony to the ability and willingness of young people to come together on common issues and explore solutions together. Why is this important for AMREF Health Africa? Because the Africa Health Agenda cannot be discussed without its #1 stakeholder, and that is the youth. 65% of the total population is below 35 years in this continent. Our greatest hope is that moving forward, strategies and programs generally, as well as more specifically for the youth, will be developed in consultation and with the leadership of young people to make them relevant to their needs. It is no longer about the youth, but about the future of Africa as a continent. We want the youth to be central in everything, not only youth affairs. Your Excellencies, ladies and gentlemen, as I finish, I would like to introduce a special young woman. Her name is Shiluni Shirim. She is an ambassador for the alternative rite of passage, of which you saw reflected in the video that ran. That video was shot in Samburu, Kenya, by a famous musician called Kambua. I have met Shiluni many times in her community, far, far from here. It takes me about 5 hours to drive there. This girl is not even within the median age that I showed of 19 years. She's much younger than that. But she is a powerful advocate for the rights of children and the rights of the girl child specifically. She embodies the spirit of possibility, determination, and courage that I see in many of the people today, a spirit that we must fan in every young person so that each of them can grow into their potential for the sake of this continent. Thank you, and I wish you a very successful conference, and I now give you Shiluni, Africa's Voice Today. Shiluni.
Your Excellency, First Lady from Malawi, Your Excellency, First Lady from Kenya, ladies and gentlemen, good morning. In front of you, it's Shiluni Shirim, as the CEO has introduced. I'm here to tell you about how the ARP has helped me to escape from many things, from the traditional African society harmful practices. ARP has, alternative rite of passage has helped me to escape from teenage pregnancy, early marriage, and also to escape from the cat. As you see our leaders, I just want first to thank them because the excellencies, because of their arrival here to meet us as youths and to give us this golden chance to talk to them. This is our day, and we thank you for the preparations you have been doing. Thank you, and you're welcome more. We will welcome you to come here again. And I just want to tell you guys that when we join our hands together, the female genital mutilation cut will end by 2030 if we join our hands together. And before I leave this stage, I just want to tell the First Lady, the Excellency First Lady from Malawi, that when you go back to your country, please take an action and make sure that all rights of women and girls are being observed. And Excellency First Lady from Kenya, thank you for this chance, and you're welcome more here once more. I also want to tell you that I myself, as you see me, the way I'm young, I can see no one here of my age, but I just feel like I'm confident and so proud to talk here to my people. Because I know now I'm talking of my right, and you people, I just want to say thank you to you because of coming here. You have come to listen to me. Thank you for the discipline and listening you have given unto me. First, I want to thank my father, Amref, and my deputy, Alternative Rite of Passage Ambassador, for their accompaniment. They have come accompany me, and also for the support they have given unto me. And also, I want to, as you see me here, my dream is to be a doctor. I'm studying in school to be a doctor, and after being a doctor, I will vote for a president seat. And you see I'm aiming higher, and you see all those things I'm saying here, all are possible without even the cut we are talking about, and we want to finish it in our country. The only thing you have to know, and also to stick in your mind, that anything is possible without that cut, that we are being forced as African girls to pass through it. Everything is possible. You can do anything, and your dreams are going to be fulfilled even without that cut, because sometimes we believe that the cut will help us to aim higher, and know higher we aim. I just want to tell you that there is nothing that we can aim higher with the cut. Because after you are being cut, after you are going to undergo FGM, you are just get married. Is that something that can make you to be someone? No. If you be a president and someone else is me now, if I undergo the cut and someone else doesn't undergo, my sibling does not undergo the cut, then after her studies, she becomes a president, but me after the cut, I become someone else woman, and even that person who is marrying me, we are not of the same age. Is that something that can make us to aim higher? No. So we can see that those things have no benefit. So I just want to tell you, leaders, please help us to fight against FGM, because I believe that when we join our hands together, FGM is coming to an end by 2030.
We need to design drugs. We need to listen to the community. We need to understand from you what your needs are, and then we need to do the research. We need to understand, and we need to make the science work for us. So what we started with was dolutegravir, you see at the bottom there, which is a tablet. And then we're working with how can we make that better? How can we add more drugs to that so that we only have one pill that we're asking patients to take a day? But let's think outside the box here. We've been looking at 3-drug regimens for a long time. Now we're thinking how we can simplify that. How can we make less toxicity for patients? Because the great news is you can all live a long time. So we want to try and reduce how much we expose you to in terms of drugs. Not for everyone, but we're looking at 2-drug regimens. And one of our exciting things, we've heard for a long time, patients don't want to take tablets anymore, particularly young people, etc., and people who are really challenged. So what we're looking at is long-acting formulations. How can we deliver our medicines for patients in a way that works for your lives? I mean, mothers, I'm not one, but I see my friends, and my goodness, you're so busy. How do you remember to take your tablets when you're focusing on your children? So what we're trying to do is long-acting formulations and different ways of delivering medicine that aren't a pill every day. And touch wood, God willing, we'll be able to deliver those to you all. Well, ladies and gentlemen, we have to collaborate to innovate. We have to work with different partners. We have to be part of the community, because if we don't listen, we don't get it right, and that doesn't benefit anybody. So we work really closely with our colleagues. What we also do is we work on access strategies. We know, and we've known for a long time, that innovation comes at a cost that maybe countries like Africa can't afford. And so we've also worked a system where we can give that special license away to those countries that need it the most, to manufacturers who can make medicines affordable. And I'm really proud that we do that. And it's very, very important. You can see examples here, including the medicines patent pool. And proudly, from my perspective as the lead for pediatrics, we cover 99% of children, the areas that those children living with HIV.
For Africa to develop and end poverty quicker, it should invest urgently in its human capital of young people, especially girls. Empowered youth and women are effective drivers of transformation. And central to these efforts must be the promotion of access to education, access to healthcare services, including sexual and reproductive health, and family planning, and empowerment and good governance. Countries need to end all forms of discrimination faced by young people, particularly adolescent girls, such as forced and early child marriage, sexual violence, which can result in unintended pregnancies, unsafe abortions, and HIV, thereby derailing their future. Some countries have made considerable progress on a number of fronts and have set the stage for demographic dividend. However, high incidences of teenage pregnancy, high rates of HIV infections, especially among young people, high incidences of child marriage, and high unemployment rates, they pose a great challenge to this realization. At the United Nations Population Fund, we continue to partner with young people, national and county governments here in Kenya, and other partners in designing programs, policies, generating evidence, and building capacity with a view to enhance the health and well-being of young people and unleash their full potential. We want young people to realize their potential.
We must ensure access to programs providing good health care, good care for nutrition, and programs which protect against issues which were movingly shown in the video on FGM. I think this is the basis from which we should start. Secondly, without good education, we will arrive nowhere. We must educate, educate, educate. And we must ensure that especially girl children remain in school. Children need to finish primary education and need to move into secondary education. Knowledge is power. And I think that Kenya has recognized this, because I think that Kenya has about the highest investment in terms of national budget in education compared to many other countries, surrounding us. And also, I think Kenya's effort to do a reform of the curriculum, focusing more on capacity and skills and reasoning than we did before, and education on important things into life, including sexual and reproductive health, are key.
Excellencies, this continent continues to grapple with huge burden of disease, and in particular, the high incidence of HIV among young and teenage persons, teenage pregnancies, increasing cases of non-communicable diseases are also a great concern for this continent. In some communities, retrogressive cultural practices, including FGM and early child marriages, hinder progress of young girls and deny them an opportunity to reach their full potential. That has been so ably demonstrated before us by our young ambassador, Ms. Shiluni. Just to cite a few of what it is we are doing, is that for us to empower the youth entrepreneurs and ensure that they access affordable credit to start enterprises and grow or build new businesses, the government has established several affirmative funds whose results are quite encouraging. The government has also, in the last 2 years, reserved 30% of all businesses being transacted in government for young persons and women. We also have continued to invest in our education system. We shall continue to review and improve on the delivery of our education system, as we shall continue investing in our health system.
It's a joy and a pleasure to be with you all today. Thank you, AMREF, for your kind invitation. We appreciate your efforts alongside government ministries and other partners for making this event possible. I particularly want to thank all the young people in attendance representing many countries across Africa. It is always inspiring for me to spend time with young citizens like yourselves who are so full of zeal, and to have conversations that shape the public agenda around issues that matter to you. More and more, our world is waking up to the reality that it is our youth who will lead the kind of reformative work that is urgently needed around the world. It is our youth who will solve some of the most perplexing and pervasive global problems we have. You are our change catalysts. You are our innovators. You are our present and our future. One of the leading public health issues affecting youth, which we need as a continent to address, is HIV. Today, HIV is the leading killer of youth in Africa, which is extremely disheartening given the amount of information we have about the disease today. Africa is home to more than 60% people living with HIV in the world and has 72% of HIV-related deaths. Over 70% of infected youth have either acquired the disease through dangerous sexual practices or they were born with the disease. These realities are troublesome. They demand our immediate attention and our committed and concerted investment to dealing with them, which is why I'm grateful for this opportunity to be part of a forum that brings together so many stakeholders in the public health sector, including policymakers and youth. As we listen to one another, I am confident that we can craft the kind of solutions and reforms that truly benefit the young people and rewrite the story of Africa.
We are committed to put young people at the center of all development agenda. Our youth, distinguished ladies and gentlemen, this two-day Youth Pre-Conference Forum under the theme Towards Healthier Africa, People, Systems, and Innovations, is the right platform for the voices of young people to be heard. This pre-conference is an opportunity for developing strategies on improving the health of our young people. It is a great moment to support several scientific research designed to embrace new technologies and methods for addressing health challenges facing our youth today and beyond. Your Excellency, distinguished ladies and gentlemen, I'm also pleased to note that this youth pre-conference is designed to foster and encourage innovative solutions to respond to the significant challenges of our youth. Allow me, therefore, to encourage you young people to venture into practical innovations that will lead to breakthrough in addressing health challenges. At least 10 out of the 17 SDGs relate directly to the youth. The Global Development Agenda is tilted in favor of the youth. We therefore have no excuse not to put the youth at the center of our national development agenda. We must prioritize the education and health of the young people. Now is the time for meaningful economic empowerment of the youth. Young people need jobs. They deserve decent and meaningful employment opportunities. Most importantly, young people need to be an integral part in decision-making processes. I wish to commend the work that AMREF Health Africa is doing across the African continent. In January this year, I had the opportunity to meet officials from AMREF in Addis Ababa. That meeting has helped to deepen the partnership between AMREF and WAFRA. I'm confident that we have a great partner for youth development in AMREF Africa. Let me thank Dr. Githinji Gitai for making AMREF a strategic partner for WAFRA. As African First Ladies, we value this partnership. On behalf of my fellow African First Ladies, I reaffirm our commitment to put young people at the center of our efforts. Let me conclude with a quote from one of my favorite authors, Margaret Mead, who once said, "Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has." End of quote. Our young people, are you present? Yes. Good. If you ever think, our young people, if you ever think you are too small to be effective, you have never been in a room with a mosquito. Just imagine in your bedroom, there's one single mosquito. I wish you meaningful and successful deliberations. It is now my singular honor to declare the Youth Pre-Conference Forum on the Health Agenda International 2017 Conference officially opened. May God bless the youth of Africa, and may God bless us all. Thank you for your attention.